Hello, I'm Dr. Bill White, and I'm a general dentist that's been doing nothing but orthodontics and TMJ work since 1970, and I want to pass on some of the things that I've learned in doing that. I'm a member of the American Orthodontic Society, which is a group of general and pediatric dentists that incorporate orthodontics in their practice. And if you're interested in learning orthodontics, and if you're a dentist, you can join the American Orthodontic Society, and we have some excellent courses for you to take, and it takes some time to do this, but you can learn how to do orthodontics and do a good job of it. So anyway, I'm going to show you some things here about bonded blocks we use to help in deep dental bites and sometimes in open bites and things too also. So this will be a deep dental bite, and I'm just going to show one case in this, but it's a very interesting case, and don't feel like it's so difficult you couldn't do something like this yourself, but you won't wait till you'd done some of the regular, real simple cases before you would tackle something like this. We bond these blocks in different areas. In the high angle cases that are skeletally open bites, whether the teeth are enclosed by it, but the high angle cases, we bond these blocks on the molars and bicuspids in the back, and we just use triad acrylic, and we take this, and you have to get a bottle of this, a little brown bottle of clear liquid that's the same chemistry as the material itself. Now this material is kind of tooth colored, and you'd pat out a little wedge of it here that would actually fit over your teeth, and I'll show that again here in another view. We put that, we first etch the surface of these teeth before you stick this on. Just etch it, wash and dry that, and then take this liquid in the little brown bottle and paint it on top of these etched teeth. Usually I do it, bond them to the lower arch on the bottom like this, and we'll put the liquid on there, and then we put a little bit on the little strip of acrylic that we have. This is triad acrylic now, and then you press it down on the teeth, and you can have them closed too if you want to, and kind of mash it down a little bit more, and then you kind of take a Bart Parker and you go in and trim off the excess. You see, we just trim this along here and take that out, and all you have to do is just have it bonded to the very top of the occlusal surface of these teeth. And after you do that, you can have them actually close if you want to. Well, you should close down, and you'll have the indentations of the teeth in the acrylic. Now you come back and trim this, the excess in between there. Just trim it off with a burr. But first you're going to press it down like this and then light cure it. You come in here with your light and just cure this where it's pretty hard. And now we can open this up, and then you trim the little excess and just leave the points where the teeth touch it here, then they can move around. Now, this is on a typodon. This is your conventional arch wire. This is your intruding wire right here. This to open the bite, so this wire would go way up come down on the other side. It's just brought down, hooking these teeth, starts raising them. This one would go down, brought up here, like it would go all the way down, and then you pull it up and tie it to these teeth to bring them down. And that's what we did on this guy, except I think the bottom was pretty well lined up. Now, after this is cured with light, you can come in and trim off the little high spots, but leave the points where the teeth touch in here so that everything comes in contact at the same time. Now, after we trim that off, you can try it back again when they move the jaw around. This is just showing the model of the actual guy's teeth right here and how we bonded that. You could start off and make them primarily from off the model if you wanted to, and then make sure you don't have any plaster in under it, and then bond it to the teeth later, but not have them come close down on it anyway. Now this is a guy that's got a deep dental bite. So instead of bonding the blocks in the posterior part of the mouth, we would bond them right up in the front part of the mouth, you see. And so when it closes to it, leaves the teeth apart and they move together. That increases the vertical dimension of the face, but this guy has a low angle to start with, so we won't open that. But if it's a high angle case, you go and bond the blocks back here in the back. And on this low angle case, we bonded it actually on its front teeth. This is a little piece right up there. I'll show you just a minute here. Now he has a terrific deep bite. I don't know that you don't see a guy like this very often, and so there's a ton of stuff to learn how to do in this case. Now there's just a whole lot of things. I'll show him again, I think, later with another aspect of orthodontics. Now he bites down and he rubs his upper front teeth on the lingual side of the lower front teeth and has actually ground them off, you see. And those teeth would be they'll be sharp right there where the goes in and slides down. Now, so the lower teeth are going to come up to here somewhere. You can see over here now where we bite together, and the lower teeth are up to that point. And so the upper teeth would be down in here somewhere. When he closes, they're going to be down. So when I open this up and have about a millimeter clearance here between the teeth, you've got a gap back in here. It's probably slightly wider than this out here in the front. Or it may not be any wider, but it's quite a distance between the teeth back here. Now we came in on this guy's case and just bonded the acrylic across these teeth and left it coming out to where it met on the lower teeth. So when this is bonded on there, these teeth can't be put together back here. So the man's chewing right up here in the front teeth, and that was kind of irritating to him. Said he couldn't eat. I said, well, you're just going to have to eat like a rabbit, you know, here. Now, some guy has got a bad TMJ, the joint back up in here is bad, and you put them chewing and doing all of it out in the front teeth, and that puts tremendous load on the joints, and they hurt and give them too much trouble. If you've got somebody like that, then you've got to go back and bond something on your back teeth also, and then that will let these teeth erupt together down here. I want to pick these up to where they're kind of lined up with the upper teeth. The bottom, I don't think we used the intruding arch at all. It's lined up pretty good like that to start with. So we didn't have to use one on it. Now, you could see how I had him open up like this, and then we bonded this acrylic on these front teeth right here and let him close down, but don't close very far, and then stopped the closure and hardened this material up real good. Now I started this in 10/31. In other words, it's almost November, uh, and so it's just got a small amount of time here before the next year. And then this is in '89, but I don't see the month. But it takes about 3.5, 4 months, before the teeth will erupt together. Now, there's a lot to learn here. We had these intruding arches on. See this trying to pick these teeth up, and it pushes down on these teeth back here. In other words, you're elevating these by pushing down on these. You're pushing up here and bringing this down in the front. Except we don't have one of those arches here, so if the bottom arch had had a big crevice fee, we would have put one on it. But we didn't have much in the way of this one being deep, so it's nearly all up here. So we just put the intruding arch on the upper teeth only here. Now, observe that the clinical crown of these teeth looks virtually identical to the crown after the teeth have moved together. You see these molars back here, and you see the height of the molar and everything. So the teeth have actually come together and come in contact, but the clinical crowns of the teeth are the same. So the alveolar bone supporting the teeth has come down with them, and you can x-ray it and see it. Simply erupted down into the mouth, even with the arch wires on there. Of course, the arch wire actually helped push these down, because you're pushing up over here on this part, and you've got to be pushing down with the same amount of force back here. So the arch wire helped bring them in, so it looks like there's nothing here to make it come in like that, but this is actually fact. Now, after we waited about 3.5 months, something like that, he began to chew on the back teeth back here. Now, once he got both sides of this chewing good, in other words, these teeth back in this area were in contact, and they were in contact over here, and he's chewing on those teeth, and it took us about 3.5 months or close to for these teeth to come in contact, and the clinical crowns are actually the same thing. So the alveolar bone is the same. You can x-ray it and show it too, as it came into the mouth, you see up here. Alright, we'll go on to the next slide. Let me erase that. Now, this is a little blown up deal, but while we were opening this bite, in other words, we had these teeth separated, we started expanding these teeth to the buccal. Also, I put a spring on the regular arch wire in here, and we're opening the gap where these teeth were missing, where it was closed up. So there's a whole bunch of things going on right here. Let me go back and then see. Now you see we had to open up this space in here, and we'll open up the space in here, and then we brought these teeth out back in the buccal, And we did that after we opened the bite. In other words, put the bite block on the front. And that allowed you to do that. So when you put the bite block up there like this, now we're able to expand this upper arch in all directions. These teeth came forward, these teeth went out to the side, same way over on the other side, and we were intruding them at the same time. You see, picking them up like that, and these were extruding at the same time back in the bicuspid molar area. Now, you just don't see that when you glance at it, and unless you just really figure out what you've actually done to this case. Now, once we get it expanded, get the upper teeth over in the proper relation with the lower teeth and the anterior out, okay, then I checked this and we've got it out there now where we really want it to be, and so it's time to take this block off the anterior part. We'd have to cut down in between, and you can weaken it, and you squeeze them together with pliers. They come off pretty easy. You don't want anything that sticks really tight. I did some one time out of concise. It took me half a day to reconstruct the teeth after grinding them out. So that person has a permanent sealant on the teeth. Concise just didn't come off at all. Now we'll go to the next one where you can see where we're having pretty good contact on the molar teeth back in here, and fair contact over here, not too good, but it's not bad. Now here we go a little bit further in, and we've got relatively good contact there and good contact over here, and of course you're contacting in the anterior part of the mouth, but he's got it separated a little bit there. Now let's take a look at the bonded block. You see, we just put this on these upper front teeth, and he bit down on it. It had a little track right in there, and that's where he chewed for about 3.5 months. So you want to make that good. It stays on the teeth though quite well. Now here we've looked at it again, and it's getting good contact with the bicuspids and molars back in the back. So we take the bonded material off the teeth. You see, we're going to remove this and take it off the teeth now. So we did that. Now you got a gap in here. You got about a millimeter clearance in here, but you got these teeth in contact, and the other side will have contact also. You see, this is contacting. All right, you better. What we're going to do now is wait just a few days or a week or two or something for this bite to close back down. You'd like for your upper teeth to be over the lower teeth, something about like that. And so this will close down, and we opened it way up, and we let it come back together again. And in just a matter of a few days, this bite closed down just extremely fast, And they do that when you open a deep bite case and you turn loose, they've got to go back down. So they start down. I don't want it to get any deeper than this. So at this point, we take the archway out and take an impression of this. Now this is a big daddy archwire in here where we're expanding this out in the buccal direction, you see. So we've activated that. And I guess we've got it expanded just about what we want to make our retainer, that we'll put some false teeth on this right in here and over here. We'll show that here in just a minute. we made this retainer and we put teeth on this part and teeth in here, and we've got a bite plate under there so it can't lower anymore. The bite can't go down any further. It's got that built in here, and he bites on that, you see. Got a little bite plate on the retainer. Okay, there's the original block. I mean, his models and showing how deep it is. And there's where we went to after he had some bridge work to fill that in. And you see the open bite, the closed bite here, and how we opened it up and then bonded these. And I sent him back to his regular dentist, and he put bridge work in on it. And it's like that. Now we went to this. Now he had a big, thick crown back here that we didn't want to shove in all that much. So we let this tooth kind of close underneath that so it can still slide back and forth in its occlusion without too much interference with that. Now the midline's slightly off, but the guy's got compared to what his smile was, he's got a fantastic smile. Now this is another finish shot a little later on down the line. And I watched this guy for years after we finished, and this thing held up just really good. And he looks like he's a little happier now. Let me go back here. So there he is. There's where it was, and there's where it's gone to. Now, you can do this type of orthodontics. It wasn't anything super duper in there. We open the bite, and then you're able to expand this and to expand the archway, push these teeth forward, these upper teeth forward, and we kind of lined up the teeth on the bottom down here to match that. It's not that, when you kind of take it apart like that, it's not that terrible the case. Now the guy's got a pretty good vertical dimension of the face. You come up something like that here and then here, and he looks quite nice now. And so this is worth doing, and this is the only case I'm going to show on the anterior part like this. We'll show some others later on, but this has held up for years. I've seen him in 2 or 3 years now, but the bridge works kind of like a retainer, but we put a retainer in there with a bite plate on it too for him. So that's the end of this series right here, and I'm going to close it out.